Brian, thank you so much. We are so proud of the science that we're able to do, and truly there's no other health freedom group at this point outside of government that's able to do that work. So the other area where we're really doing cutting edge work is in the area of litigation. If we can solve problems through advocacy and education, that's fantastic, and science alone, but sometimes that's not possible. So even before COVID, we were fighting on behalf of families to have choices to make about the very serious medical interventions of vaccines. So we fought in New York, we fought the repeal of the religious exemption, and we took that all the way to the Supreme Court. And we lost, and one of the things we've learned the hard way is the courts follow culture, but what we're seeing is that the culture is shifting radically. And so we are starting to see real changes. But I want you to know that we've been in this fight a long time. So we've been fighting on behalf of families for religious exemptions. We've been fighting in New York, in other places, on behalf of children who've been wrongly denied medical exemptions. Medical exemptions were put in place in 1905. It's outrageous that medical associations and states are basically denying appropriate medical exemptions. But during COVID, we really had to step up. There were not groups, the groups that you would have thought would be fighting for free speech, for freedom of association, for freedom of conscience. Those groups were nowhere to be found. And so under Bobby Kennedy's leadership in litigation, we stepped up, and we have major cases still ongoing against the censorship that the government put in place, that the media put in place, and that the social media in particular put in place. So we have a case right now before the US Supreme Court against Meta platforms, against Facebook, that kicked us off of Instagram and Facebook way back in 2021, and we haven't been reinstated. We have a case against the Biden administration because they were colluding with social media to telling social media, ban Bobby Kennedy, ban CHD. We have a case against the corporate media, Trusted News Initiative. They also were collaborating, and this is an antitrust case. They were trying to squeeze us out because we were stealing their lunch, right? The independent media, the podcast world, the website world is really taking away from corporate media because, let's face it, they lie a lot. So those cases are still ongoing, but now that COVID is somewhat receding from view, we're going back to really our roots, which is fighting on behalf of children, fighting on behalf of families so that parents can make the decisions they want to make for their children. And one of the things that we've been fighting for since COVID, but we're continuing and we're starting a new challenge on this, is related to what's called the PrEP Act from 2005, which basically made possible these emergency use authorization shots with no liability from anyone. That's still being promulgated, and so we're working on a new challenge that we think may be successful. There have been many, many unsuccessful challenges to the PrEP Act. It's very, very hard. They've made it very airtight. Another area where we're very active is related to electromagnetic radiation and litigation. And we are bringing this year something called 704 No More. We have a website, 704nomore.org. And that is, we want to challenge the 1996 Telecommunications Act itself that allows the federal government to allow telecom to put towers and antennas wherever they want, infringing on people's homes, infringing on their health, with literally no recourse. We've tried this supporting local jurisdictions. We've tried using the Americans with Disabilities Act. We've tried the Endangered Species Act. We've tried lots of different legal, not only trying the theories, but we've brought cases, and they haven't been successful, so we're now moving towards a frontal assault on telecom. But one of the big cases we've been working on for many years is related to the vaccine Gardasil, a human papillomavirus vaccine. Very dangerous vaccine, and I'm delighted that our board member, Michael Baum, and a leading litigator in this case against Merck is here to tell us about it. Michael.